Talk about the use of codeine, which has increased alarmingly in our country. It's according to the study, as Tumza mentioned, by the Community Epidemiology Network on Drug Use, finding that there's a growing reliance on over-the-counter painkillers. Let's bring in Jackie Mayman from the Independent Community Pharmacy Association. Morning, Jackie. Good to have you on eNCA. When we talk about over-reliance, can we go as far as to say it's codeine addiction? Would you agree with that? Good morning.
Good morning, Gareth, and good morning to all the viewers. Yes, unfortunately, I would agree with that. We are definitely seeing an increase in the misuse, abuse, and addiction to codeine-containing products.
Why is it so easy to access codeine?
So codeine-containing products are available, what we call over-the-counter or on a pharmacist-initiated prescription. And so it is more easily available than those that you have to go and visit a doctor, get a prescription, and then go to the pharmacy. But one of the biggest challenges we have is the fact that each pharmacy cannot see what you have purchased at a different pharmacy. So we see a lot of pharmacy hopping. So, you go to pharmacy A, you buy your codeine product there, go to pharmacy B, buy some more, and it's very difficult to manage that.
One could imagine then that it should become prescription medication only. Anything with codeine in, you have to go see your doctor, or is that going too far?
Yeah, I think we as the ICPA, we believe that is probably one step too far. Before that happens and before we limit access, we believe that we could put a mechanism in place, which would be a centralized database, where when you give your ID number and you purchase a codeine-containing product, it would go to the cloud-based database and alert the pharmacist if codeine has been purchased elsewhere. Remember, it is not only when it is being abused or for addictive purposes. Codeine in certain products is a very useful painkiller, cough suppressant for everyday use. And so we believe making it a prescription-only medicine will put it out of reach of many people who cannot afford to go and see a doctor.
So where do we begin to look at a centralized database like this? Because I couldn't even begin to name all the different kinds of pharmacy groups and pharmacy brands. There are the big ones. I would imagine they would have a database of some kind. So talk to me about this database. Is it a pipe dream, or is it in the pipeline?
No, it's actually already being developed. The database is there, but what we require is our statutory councils, for instance, the South African Pharmacy Council and SAHPRA, to actually make it a regulation and say all pharmacies need to belong to it. So it's already there. If a patient gives an ID number and that is linked to what we call a NAPI code, which is the drug code of a codeine-containing medicine, it already will store the information. The challenge is we need everybody on that database. We need dispensing doctors, we need pharmacies, we need the wholesalers. Everybody needs to be feeding information into the centralized database for it to be effective. Obviously there are a few, unfortunately, rogue, let's call them dealers out there, and they will be the ones that don't join the database. And so there will be leaks, and we need to stop all those leaks. We have presented this to both Pharmacy Council and SAHPRA, and we are busy in negotiations with them to make it mandatory that all suppliers of codeine-containing products subscribe to this database, in the hopes that then we will be able to better manage this crisis. And Gareth, it really is a crisis because it's predominantly youth that are being affected. And we know it's a centrally acting drug. And we're talking about children whose brains are not fully developed. And it really can, in the long term, cause brain damage, aside from all the other afflictions.
Jackie, last question. You make a good point about the youth. It's something I'll bring up later when Tumza and I interview and speak to Dr. Joe Pata, the health minister, of course. Jackie, what would you want the health minister to do about this? We'll put your question to him later, or your comment. What would you tell him?
Oh, I would say, please, Joe, please, Minister, get SAHPRA and Pharmacy Council to make it's called the Codeine Care Initiative, make the Codeine Care Initiative regulation. and make it compulsory for all suppliers of codeine-containing products to subscribe to this. What it will do is it will allow pharmacists to be able to see if anybody has purchased codeine within the last 30 days, but it will also allow the regulators to very quickly identify suppliers of codeine who are oversupplying, either to an individual or individuals, or that are just supplying too much codeine, because we would want, as you say, the wholesalers and manufacturers to feed information into there as well. Because, Gareth, it's not just over the counter. We know the trucks are being hijacked. We know that there's internal theft where huge amounts of these codeine-containing syrups disappear. And we really need to get a handle on it in terms of public health in this country.
Jackie Mayman, I appreciate your time as always from the Independent Community Pharmacy Association, speaking to the Health Minister just after 7 o'clock here on eNCA about a wide variety of issues within the health sector, of course, but we'll definitely bring up this concern around codeine addiction. And I'll put forward, I'm sure Tums and I will, that comment from Jackie Mayman, Independent Community Pharmacy Association, tightening down, Tumza, on the availability of codeine, especially for the youngsters.
Especially.
That was a good point.
Yeah, quite concerning, that data. All right, moving